All right. So you should be able to see my screen at this point. So as usual, this will be posted online in the next few days. If you're not with the schools or the health department, I just ask you drop off the call. And make sure and pass along any information to those who may need it in your departments. First thing I wanted to share is just a really quick synopsis of a great blog post that I encourage you to read if you have time. It was written by the Policy Lab at Children's Hospital of Philadelphia. The Policy Lab is a department in the CHOPS Research Institute, which is a really large pediatric research institute. They have a lot of other great initiatives besides just looking at education during COVID. So again, it's a great place for information. I've used them a lot during the pandemic for guidance for education systems. But their most recent post, again, was just really well worded. So what they had to say in a nutshell was that early in the pandemic, the primary defense that we had was to limit person-to-person transmission via distancing and mask use. These strategies were necessary to buy us time and save lives until we had more sustainable interventions, such as vaccines and treatment strategies. Then we had more testing available, and then we had vaccines that became available as well. So now we're over a year into vaccine availability and outreach. We have quite a bit of population immunity from vaccination and natural infection. And we're at a point where we feel that there's fewer population-wide public health measures needed, such as masking and other things. So it's true that right now we are seeing a little bit of an increase in cases, and we know people that are becoming infected again, but on average, they're not experiencing as severe of disease or requiring as much hospitalization as previously. So these experts feel that we can continue with thoughtful reductions in our restrictions and avoid reinstating requirements such as masking or other limitations unless hospitalizations begin to rise significantly. Also, we should continue to focus on optimizing resources that bolster or encourage vaccinations and improve the awareness of newly available effective treatments across communities. So, not saying that there's not going to be any uncertainties along the way, and they're going to continue monitoring for any evidence of worrisome trends in the pandemic, including increased hospitalizations related to COVID. And the researchers need to continue working on optimizing vaccinations, such as identifying when boosters may be needed and continuing to add new therapies to the market. So, pointing out that COVID will continue to exist in our world. What question they're seeing most right now from communities is how to host, or can people host traditional year-end events like proms and graduations. And their feeling is, yes, continue to have normal activities at this time. If possible and if reasonable, if you can do things outdoors or have things in larger areas and improve ventilation, that's great. But really we need to get back to a life as normal for our students. If there are clustered outbreaks, make sure to notify your communities, make sure to notify your families, and offer testing. But the potential for some clustered outbreaks should not really be a deterrent for hosting events. And it's just important to try to get school back to normal and getting things caught back up. So again, I thought that was just a really well-worded blog post from these experts. Again, they're physicians and epidemiologists, and they've been working all along to give guidance for this. The next thing I wanted to share, this we were told was sent out to you guys on the 29th of April. Just a reminder of posting or reporting any unused or expired test inventory to the state so that they had that information to get your test counts appropriate for you. And just a note, if you do have unused test kits that are expired, so again, they've not been used on a person, you can just throw away those expired test kits in the regular trash. They don't have to go in biohazard or anything. You can just throw them away. Just another reminder that we got that the state does have those office hours to talk about any questions you might have about testing. And they did revise those from twice weekly to once a week. So just put that information there for you. Johns Hopkins Center for Health Security is another fantastic resource for all things that are COVID. They recently posted or started a website with testing frequently asked questions. So I just wanted to share that link. It's just covidtestinganswers.org. So they have tons of different FAQs there. So if you ever have questions about testing or your families do or the community, that's just another good place to go. The state also has updated their website. It's michigan.gov/coronavirus-contain-covid/test. They have links to what libraries have home test kits, to where people can order home test kits. You can now order those twice for each address, to how to find testing and all kinds of different things. So just a reminder that as we get into the long haul with this, early testing and treatment for those who are at high risk, which is really an extremely long list of conditions, is becoming more and more important. And so as you think about your fall plans, to consider testing for those that are symptomatic, or if, again, you're seeing a cluster or an outbreak starting for those that have been exposed, is going to be an important tool. So I just put this in here, again, for your staff or just for your own knowledge, or if it's something you want to share with your school community. There are numerous test and treat locations throughout the state. Those are areas where people can get tested, and then if they are eligible for treatment to help prevent serious illness and hospitalization, they can immediately get set up with treatment. A website that describes all the different treatment medications and preventative treatments that are available, and then a list of all the different medical conditions that put people at higher risk for severe illness. This is just a recent publication that came out looking at kids 5 to 11 that did become ill during Omicron, so December to February. And those that were unvaccinated, 9 out of 10 kids that did get infected and ended up in the hospital or really sick, 9 out of 10 were unvaccinated. So just looking at the risks of vaccination status there, and a third of them had no underlying conditions, but kids with diabetes and obesity were more likely to have severe illness. So again, the overall hospitalization rate for kids is low, but vaccination does help prevent that. And again, it's not always just kids with comorbidities that end up hospitalized. I just wanted to share this too. Last time we talked, I said we'd had no pediatric flu deaths in Michigan. And then that afternoon, we did get a press release that there was a child that died from influenza in Kalamazoo County. As of the 23rd of April, there have been 23 pediatric flu deaths in the United States. Unfortunately, only about a third of Michigan residents 6 months of age and older have been vaccinated for the flu this year. And kids 6 months through 17 years, only about a quarter of them have been vaccinated against the flu this year. Fortunately, it's been a bit more of a mild year, but again, as you can see, we have had some pediatric deaths. So the MyStart map still has not updated their data. They're still working on getting it to look like the new CDC community data, but otherwise they still have all the other data there. And then the CDC, again, has lots of good data there. This is the United States as a whole. The larger graph here is the last 6 months, and the United States is seeing just a very mild increase. Again, that's for the entire US. The smaller inset there is for the entire pandemic. This is Michigan, same thing, 6 months, and then the entire pandemic. And you can see we are also seeing a bit of an increase. If you're looking here at the community levels, we do have some counties that are in the medium risk level. We do have a few in our jurisdiction, and that largely is due to some increase in the new admissions to hospitals due to COVID. I just wanted to show you this. This is the kind of the old classification we used to use. So the case rates per 100,000 over the last 7 days is what these are showing. So a lot of our counties are back up into the high case rate, but looking at this, bringing into it the hospitalization rates and the hospital beds occupied by COVID patients, that is keeping us in the lower categories. So again, we are seeing more cases, but we're not seeing a lot of hospitalizations from them. This is really tiny, so I apologize, but it's just to give you an idea. These are the top 30 states for increases. The trend here is 0 to 100, and that's the top line would be states that have gotten to 100% of the peak as of January of 2021, so kind of the pre-Omicron peak for the US. Basically just a way to kind of compare things to themselves in a way. I know it's kind of a weird way to do it, but just to give you an idea of where some states are. So the US as a whole, again, just gradually increasing here recently. There are some eastern states that are seeing more of an increase. Michigan is down here, kind of around number 20 or so, and really plateauing off. But just to give you an idea that there are some states seeing more of an increase. After Ohio, pretty much everyone's about flat. So this is the state's data and modeling update for this week. Again, the percent positivity has been increasing, still under 10%. The daily cases per million have been increasing, and the hospitalization rate is relatively stable. About 3% of hospitalization each day are due to COVID cases. The age cases breakdown, still the highest are the 30s, the 20s, and the teen ages. So that younger age group testing positive. The hospitalization rates, again, you're seeing it starting to pick up here. The ICU rates are staying stable, so suggestive that the cases are not quite as severe. The pediatric hospitalization rate has really stayed pretty stable as well. So this line here is shown kind of the increasing trend that was projected, and it really has followed along. So the hope is that we're going to be hitting sort of a plateau this next week or two, and then hopefully going to decrease again. That is the hope. So the hope is that this is sort of the worst it's going to get for this little blip. We're not going to truly see a big spike. The dark purple counties are currently seeing an increase in cases. So the majority of Michigan is seeing an increase, but again, it's not a serious one. This is kind of a busy slide, but just demonstrating that some of those southeastern counties like Wayne County and Washtenaw right now are in the medium category, but they may click into the high category within the next week or so. because of their case rates and their hospital admissions. So they're keeping a close eye on that. In terms of our variants, some of you may have heard Omicron has now many subvariants. So Omicron itself then kind of changed into the BA2 subvariant, and now there's a B2121, a BA11, a B11529. So it's just got multiple subvariants. You can see here the green bars are the samples tested at the state that have been the original Omicron, and then the red are the ones that have been tested that are the BA2. So over the last month, really almost over a month, it's been pretty much all the BA2 subvariant. With these other subvariants, this kind of explains it. They really don't appear to have any differences in how transmissible they are, severity of illness, likelihood to cause hospitalization. But obviously it's kind of early on in these changes, but they just seem to be kind of submutations and not so much of a clinically significant issue, just more of a genetically significant issue. I just wanted to throw this one in here too. Another report that had recently come out just confirming that last calendar year, COVID was the third highest cause of death behind heart disease and cancer. So that is just some more information to share. So finally, given that things are, knock on wood, I don't want to jinx us, but that things are quite stable and I don't think there's a lot of new updates coming. I was going to make this our last meeting for school year, and then we'll see, if we need any others, and then if we need them next year. I'm certainly open to your guys's consideration, your recommendations, what your thoughts are with that. You definitely, hopefully know how to get a hold of all of us if you have any questions or concerns. And if we get things that we feel need to be passed on to you, we will definitely do that. But at this time, I will stop sharing my screen and open it up to questions. So I will go to the chat. If you guys have questions, put things in the chat. So far, there's nothing in the chat. But if you have a question, add it to the chat, or you can unmute yourself and ask your questions. Or if you have any opinions about meeting cadence, let me know. All right. Well, we'll get the slides and the recordings posted and out to you. And again, we'll just cancel the rest of the meeting series for the year. And we will let you know when and if other meetings need to be scheduled. Hopefully next school year will be business as usual, but if things are different, we'll continue with meetings. Certainly let us know if you have any opinions about that or anything. You guys have a great summer. And again, we are always available if you ever have questions or need anything. Remember the State Communicable Disease Guide for Schools is a fantastic resource for all communicable disease issues. You guys have been fantastic. I know this isn't the end of anything, but you guys have been great and very diligent. And hopefully this just leads into better things to come overall. So again, whatever you need, just let us know and we'll get things out to you. And again, keep in touch.